Stroke and heart attack are often confused because both are medical emergencies. Both involve blood flow, and both can become life-threatening within minutes. But they affect different organs. A heart attack happens when blood flow to the heart is blocked. A stroke happens when blood flow to the brain is blocked, or when bleeding occurs inside the brain. Understanding the difference can save a life. So what exactly is the difference between a stroke and a heart attack? A heart attack, also called a myocardial infarction, occurs when one of the coronary arteries supplying the heart becomes blocked. The heart muscle needs oxygen-rich blood to keep working. When this blood supply is cut off, part of the heart muscle begins to get damaged. A stroke, on the other hand, occurs when the brain's blood supply is interrupted or when a blood vessel in the brain bursts. Brain cells need oxygen constantly. If they don't receive it, they begin to die within minutes, which can affect speech, movement, memory, and consciousness. The main difference is the organ affected. In a heart attack, the problem is in the heart. In a stroke, the problem is in the brain. Their symptoms are also different. A heart attack often causes chest pain or pressure, shortness of breath, sweating, nausea, dizziness, and pain spreading to the arm, neck, jaw, or back. A stroke usually causes face drooping, arm weakness, speech difficulty, sudden confusion, vision problems, dizziness, or weakness on one side of the body. A simple way to remember stroke symptoms is fast, face drooping, arm weakness, speech difficulty, and time to seek emergency help. For heart attacks, the key warning sign is usually pressure, tightness, or pain in the chest, especially if it spreads to the arm, jaw, or back. Both conditions can be caused by similar risk factors. High blood pressure, high cholesterol, smoking, diabetes, obesity, lack of exercise, and unhealthy diet can damage blood vessels over time. These factors increase the risk of blood clots, blocked arteries, and reduced blood flow. The understanding of stroke and heart attack has improved greatly as doctors studied how blood flow affects vital organs. This knowledge has helped develop emergency treatments that can restore circulation and reduce long-term damage. Both stroke and heart attack require immediate medical attention. The faster treatment begins, the better the chances of survival and recovery. In heart attacks, doctors focus on restoring blood flow to the heart. In strokes, treatment depends on whether the stroke is caused by a clot or bleeding in the brain. Today, artificial intelligence is helping doctors respond faster to both conditions. In emergency care, AI systems can analyze ECG results, heart data, CT scans, and MRI images within seconds. For heart attacks, AI can help detect abnormal heart patterns. For strokes, AI can highlight blocked blood vessels or bleeding in the brain, helping doctors make quicker treatment decisions when every minute matters. Stroke and heart attack are different emergencies, but both are caused by problems with blood flow. Understanding the signs, knowing the difference, and acting quickly can save lives. But what happens when a child is born with a heart problem from the beginning? In our next video, we'll explore congenital heart disease explained.